in the show, and don't go anywhere. You really don't want to miss it. But let's get back to the matter at hand, as Leanne has pointed out. So yesterday, South Africa's health ombudsman, Professor Malegapuru Makgoba, issued a report in response to earlier media reports and also a formal complaint that was lodged by Dr Kiran Sukeri, who worked at the Tower Psychiatric Hospital in the Eastern Cape. Dr Sukeri complained about the inhumane treatment of mentally ill patients and the horrific condition of the hospital. And in summary, the findings reveal that the conditions at the hospital are about systemic failure of the health department, but there is no deliberate abuse, and there's also no degrading and inhumane treatment of mental patients by the staff at that institution. Minister Aaron Motsoaledi is joining us from our Pretoria studios, and also joining us for the discussion is Bhengukazi Shongwe, acting CEO for the Central Gauteng Mental Health Society. Minister and Ms. Shongwe, thanks so much for coming through.
Thank you.
All right, we'll fix the minister, bump up his sound there. And let me start with Minister Motsoaledi. Minister, the report, of course, points to no human rights abuses in actual fact, but it does point to the Department of Health and, perhaps not doing its best when it comes to the systemic issues that need to be addressed by your department. So what is your response to that?
Well, we welcome the fact that the Ombudsman has recommended that I put an administrator to take over the mental health care unit in the Department of Health in the Eastern Cape, just the mental health care unit. Because indeed, after the Life is Demeni saga, we did send officials all over the country to check, because we did not want the incidence of Life is Demeni to repeat itself. We did find a lot of weaknesses in quite a number of provinces, including Eastern Cape, and we wrote very strong recommendations of what needs to be done, and we conducted a lot of workshops on some of the issues that needs to be done. But now that the Ombuds investigated and found that some of the issues are still there, it is welcome that he then said, I must put up an administrator, because then it means we are directly in charge from the national office rather than relying on what is happening down there.
And this, of course, as many would say, following on what was revealed in Life Esidimeni here in Gauteng, now you have this situation in the Eastern Cape. And it's not for the first time that you yourself, Minister, are pointing out perhaps the shortcomings in the system as it currently stands, whereby the MEC reports to the Premier and not to the Minister of Health directly. And in that, it also creates problems in terms of how you are able to address the situation. So are we going to go through this problem province by province, or are we now going to see a push to actually have that matter addressed?
Well, you are talking about 4 issues, Akina, when you describe that type of situation. But let me first say, the Ombuds made it very clear that there is absolutely no similarity between Life is Demeni and what happened at Tower Hospital. That was very clear in the report. And I just want to emphasize that there is absolutely no similarity. But there are weaknesses in the mental health care system, which we recognized long ago. You'll remember that the World Health Organization, in recognizing the problem globally, that mental health seemed to have taken the back seat, called a conference in 2013, where they drew up a mental health strategy and plan. We domesticated that program in the same year. We called a summit here in South Africa, and we drew up on what needs to be done. And we are aware that most of it has not been done, because it's in 4 areas. It's in human resources, it's in financial management, it's in procurement systems, it's on infrastructure and equipment. And those are the 4 things that seems to be overall complaint within the healthcare system, including what is happening in the Eastern Cape.
And those are systemic failures, if you'll agree with me, Minister. So, you know, how are we going to address these going forward? Because, as you rightly point out, it seems that healthcare and that provision seems to be at the bottom of the ladder here. But how are we going to address that with the necessary urgency going forward?
I never said so, Sakina. I said mental health seems to be taking a back seat, not only in our country, globally. And I'm saying that's why the World Health Organization itself called a summit in 2013 to try and correct this. When they noticed it, that there is an explosion of mental health, but it seems to be taking a back seat within healthcare systems. And I'm acceding that that is the situation also in our country. That mental health seems to have taken a back seat, and we have to work hard to change it. Now, you are asking me, how are we going to change these situations? We have put quite a number of proposals in the new plans that are coming, like changing the healthcare system through universal health coverage. You'll realize that in that white paper on NHI to move towards universal health coverage, we are proposing that 9 acts in the country needs to be changed, including the National Health Act 2003, the Mental Health Act 2002, and many other acts, and there's a 1212. You'll also remember, Sakina, that in the recommendation, among the 18 recommendations of the health ombuds, is that if we are to get the situation right, we need to review the National Health Act 2003 and the Mental Act 2002, and we are definitely in the process of doing so.
Let me come to Ms. Shongwe. Your organization deals with these issues at ground and grassroots level. Yes. So how would you describe the situation when it comes to mental health and how these issues are treated in the main?
Okay, thanks very much for the question. I'm from Central Gauteng Mental Health Society. We have social work programs and rehabilitation centers, residential facilities. So at this stage, what is needed is it's a partnership with all the stakeholders involved in mental health care. For example, the government cannot work alone or cannot do it alone. They need to involve us, especially NGOs, because we are the ones who are providing the service. We are the ones who are feeling the pain, who are feeling the pressure to provide a service irrespective of the budgetary constraints that are there. The government, I feel that they are trying, but it's not enough. They need to come to us and hear our needs as NGOs, because first of all, the licensing process is very difficult to attain, especially for NGOs like us, who have been in existence for a long time. Now we are being told that we need to have this certificate and this certificate. It is very difficult to attain those certificates. They are very costly, and there is no budget allocated by the department for us to access that. And we have residents that need to be in our facilities. So now we need to hear more from the Department of Health. What is their plan in helping us to access those costly licensing documents that they need? And also the needs at the grassroots level, the funds, the funding. It is nothing. It's just a drop in the ocean, because we are being funded per service user. And we have dedicated staff members, professionals, whom we need to pay salaries at the end of the month. But with what we have, we are struggling. We are struggling. So we feel that the government, yes, is doing something, but it's not enough. They need to involve us more and hear from us. You know. So as we speak now, I am afraid of October, because we will be expected to have those documents, the licensing documents, and we don't have. And what will happen to us? Does it mean that we're going to close now? And what will happen to those service users? So I feel that the Department of Health, after the Life Esidimeni saga, the approach is more reactive, because now we are not given the opportunity to find ways and work with them to say, okay, how can you help us better to have those documents that you need now, like the occupancy certificate. It's very difficult for us to have.
We're going to take a short break, and when we
you.
come back, I'll allow you to finish your point and also get a response from Minister Motsoaledi from a service provider on the ground raising the concerns that you have in that regard. So don't go anywhere. We'll be back after this.